Hello. So today we are going to discuss an important topic, that is how to read a chest X-ray in 10 easy steps. So step number 1 is to look for the preliminaries. For example, the data of the patient. Which patient, how old, and when was the image taken, like at which date. So we have to look at this data first. And also we have to look at the detail of the X-ray, that is it a posterior interior or anterior posterior projection, is the patient rotated or not, is there adequate penetration, or has the patient taken an adequate breath. So these preliminaries data we have to look for first. This is the step number 1. Now step number 2. In step number 2 we have to look at the trachea. In trachea should be widely patent and should be central in the chest. Step number 3, we have to look at the mediastinum. In the mediastinum, the aortic notch should be just visible, the left hilum should be slightly higher than the right, and the hila should be symmetrical in size. Step number 4, look at the size of the heart. The heart size should be less than 50% of the thoracic width on a PA chest film. Also, assess the heart borders. Step number 5. Look at the diaphragms. The right hemidiaphragm is usually higher than the left. Look for the air or gas under the diaphragm and for the elevation of the diaphragm on either side. Step number 6. Look at the pleura. The costophrenic angles should be clearly visible. Look for lung markings extending to the chest wall, and also look for evidence of a lung edge. Step number 7. In step number 7, look at the lungs parenchyma. Is there consolidation of the upper lobe, middle lobe, or lower lobe? Inspect each part of the lung looking for round shadows and lung parenchyma for interstitial changes. Step number 8. Look at the bones. Inspect all ribs for evidence of fractures, fan bones, epili, osteopenia. Are there any lytic lesions? Step number 9. Soft tissue. Observe the soft tissue around the rib cages. 10. Look for an externally applied devices.